Lyme disease is often abbreviated as LD for future reference. My name is Andrea Kincaid. I am partnered up with Christine Kober. We are going to talk to you today about Lyme disease. It is just one tick away.
Hi, I'm Christine Kober, and we're going to start this with a little bit about the history of Lyme disease. Lyme disease was first identified in the U.S. in Lyme, Connecticut. That's where it gets its name. In the early 1970s, there was an unprecedented outbreak of juvenile arthritis in this area. There was also an increase in arthritis for adults, but the rarity of the juvenile arthritis caused an investigation to be started into why this was happening. Researchers discovered that many of those children lived and played near wooded areas. They began having symptoms in the summertime. Some of them recalled having a rash in the summer, and some even remembered being bitten by a tick. They determined the disease came from tick bites and named it Lyme disease. In 1981, a scientist named Willy Bergdorfer was studying Rocky Mountain spotted fever, another disease from tick bites, when he decided to investigate the similarities of symptoms of Lyme disease with a rash in Europe called erythema migrans. Both bacteria were spirochetes, and after studying them, he concluded that they were the same. This bacteria was named in his honor and is called Borrelia burgdorferi. My next slide is about the bacteria itself, Borrelia burgdorferi, what shape it has and whether it's gram-negative or gram-positive, and those other important characteristics that make it unique. Borrelia burgdorferi is a spirochete, which means it's spiral-shaped. Because it is a spirochete, it has the endoflagella, or axial filaments, between the cell wall and the cell membrane, and that is how it moves. This bacteria is not classified as gram-negative or gram-positive because it's too hard to see even after staining. It's because they're so thin. It does have a real weak gram-negative stain, but it is best viewed using dark field illumination like the picture to the left. Borrelia burgdorferi has been divided into three genospecies: Borrelia burgdorferi sensu stricto, Borrelia guerini, and Borrelia afzelii. The first one is the one found in the U.S., and the other two are more commonly found in Europe and Asia.
Now we're going to talk about the reservoir, how the bacteria travels from one host to the next. The reservoir for Lyme disease is the black-legged tick. This tick transmits the bacterium Borrelia burgdorferi into the host as it feeds. In other words, the tick is the disease parasite, and the host is the unfortunate new host of the bacterium as well. Next, we're going to talk about ticks and what ticks to look for. Which ticks carry the bacteria strain for Lyme disease? Black-legged ticks spread Lyme disease. These shown here are known as deer ticks, or Ixodes scapularis. This tick is widely distributed in the northeastern and upper Midwestern United States. It is said that the upper Midwestern United States is more likely to receive Lyme disease from these ticks than any other location on this map. The other black-legged tick which spreads Lyme disease is the western black-legged tick, the bear tick, or Ixodes pacificus. This tick is distributed along the Pacific coast of the United States. The life cycle of the tick is from egg to larva to nymph to adult. Highest risk for infection with Lyme disease for a host is in the spring or summer. Ticks are tiny. An adult tick is about the size of a sesame seed, and the nymph is the size of a poppy seed. Ticks like to get cozy and stay hidden. They like to settle in around the groin, armpit, back of the knee, or along the scalp. When the tick bites, it transmits the bacterium Borrelia burgdorferi into its victim. This usually happens once the tick is engorged. Here we see the pattern of the tick as it increases in size or engorges itself on the host's blood. The final nymph size, if it began as a nymph, is about the size of a small grape when it is fully engorged. And this is the time when the blood flows into and out of the human body through the tick, and the bacterium can infect the host. Remember that these nymph ticks are tiny in size. They're 2 millimeters, or the size of a poppy seed. Oftentimes people brush up against them with their pets as they're venturing into the woods and become accidental hosts to these ticks. Ticks will accept anything that will give them blood, but small mammals such as the white-footed mouse are more prevalent in the woods, and they love to attach to them because the mice burrow down with the other mice in the ground during the daytime, and then the ticks have a large resource to pull from, and they can do it in peace and decide where they want to latch on in peace. And so these people become hosts accidentally, and the nymphs often go unnoticed until they're fully engorged and therefore are responsible for nearly all of human Lyme disease cases. We wanted to talk to you a little bit about how Lyme disease is not transmitted. There's no evidence that Lyme disease is transmitted in the following ways: person-to-person contact, like touching, kissing, sex, etc., breast milk through blood transfusions from dogs and cats, from eating venison or squirrel meat, or through the air, food, water, or from the bites of mosquitoes, flies, fleas, or lice. The reservoir for Lyme disease is the black-legged tick.
Next, we're going to talk about signs and symptoms. And as you know, a sign is something that can be observed by somebody else who's not infected, like blood work or results or some sort of physical manifestation on the person infected. But a symptom is more something that that individual person feels, and sometimes it can be different for everybody. The first sign of Lyme disease is a rash, a solid red or a bullseye rash. And this rash is called EM, or erythema migrans. The bullseye rash is pretty characteristic of Lyme disease. That's pretty unique to this disease. And sometimes the rash will start off solid red, and then it starts to lighten up in the middle of that bullseye, and that's when you get that specific design. And the rash appears around the site of the bite. So the center of that bullseye will be where the tick bite is. And you can get a rash in other parts of your body, but usually the biggest one is the one at the site of the bite, and they can measure up to 12 inches across. Now, accompanied with the rash are symptoms which make you feel like you have the flu: fever, fatigue, headache, chills, stiff neck, and muscle pain. Those are some of the most common symptoms that people have. If left untreated, you enter into the second stage of signs and symptoms, and one of the signs can be facial palsy, which is a loss of muscle tone in the face. And it's commonly evident when one side of your face will sag. You'll smile, but only half of your face is smiling. And you can have it on both sides of the face, but it's definitely more obvious on one side. You can also get meningitis. The stiff neck and headaches are kind of a sign that you're getting meningitis. So if untreated, it can lead to meningitis. Some of the symptoms are the first stages of arthritis. You get painful swollen joints, and you can have tingling or numbness in your extremities. If continued to be left untreated, which sometimes happens because in that second stage, some of those symptoms clear up on their own, and they resolve on their own, and people think that they're feeling better. But they eventually could start to develop arthritis and could start to have some serious neurological disorders, such as difficulty with short-term memory.
Next, we'll talk about how to prevent obtaining Lyme disease, or in other words, how to prevent a tick from biting you. To prevent Lyme disease, a plan to avoid, repel, and remove ticks needs to be established. To avoid tick bites, avoid the areas they thrive, like dense woods and grasses. To repel ticks, wear light clothes with socks tucked in, walk along the center of trails with foliage around, and wear the repellents DEET or permethrin. Next, we're going to talk about the best possible way to remove a tick. There are different ways to remove ticks as best as possible after you adventure outdoors. You can bathe yourself within 2 hours and check for ticks that way. Conduct a full body check as soon as you walk in. Parents should check their children. Examine your gear and pets that you had outside with you. Put clothes in a dryer on high heat for an hour to kill remaining ticks. And see a doctor if symptoms of Lyme disease occur after you've been bitten by a tick. Also, I saw a website where a woman from South Carolina had what was called tick bombed repeatedly, where ticks just infest her body, and she would take out packing tape and stick the tape to them. They would glue to the packing tape and remove them that way as they were climbing all over her body. And she says that's something she arms herself with when she adventures outdoors in the springtime there. To remove a tick as safely as possible, use a pair of precision tweezers. Pull firmly and steadily out from the bite site. Place the tick in a vial or jar with alcohol in it to kill it. Clean the bite wound with disinfectant. If you show signs, again, of symptoms of Lyme disease, make sure you go and see a doctor. Next, we'll talk about which treatments are available for Lyme disease. The treatment used for Lyme disease is antibiotics. For early Lyme disease, the drugs doxycycline, ceftriaxone, and amoxicillin are used for treatment. The same drugs are prescribed for children, but at a lesser dosage. Treatment is 14 to 21 days. Post-treatment Lyme disease syndrome, or PTLDS, needs longer antibiotic treatment.
You may have wondered if there is a vaccine for Lyme disease. Well, my next slide will answer that question. So there was a vaccine for Lyme disease, but it was discontinued in 2002 because of low demand. Since vaccines usually require repeated doses, or you need to have them every few years, those who were previously vaccinated back before 2002 are no longer protected from Lyme disease today. Most cases are successfully treated with antibiotics, so they may not seem like a life-threatening disease to most people, and they probably feel like they aren't at risk if they don't go out in the woods or don't live in an area where it's more prevalent, and that might account for the low demand of the vaccine. My last two slides just show the prevalence of Lyme disease across the U.S., just as a little bit of added information. This map shows the reported cases of Lyme disease in the U.S. in 2013. There's a higher concentration of reported cases in the Northeast. Ticks predominantly feed on deer, and the largest incidence of Lyme disease is in areas with a high deer population. Though Lyme disease cases have been reported in nearly every state, as you can see on the map, it's all over, cases are reported from the affected person's county of residence, not the place where they were infected. Some people become infected while traveling or on vacation and return home, start to experience symptoms, go to their doctor, and then they're diagnosed with Lyme disease in their home county. This chart shows the reported cases of Lyme disease in the U.S. from 1995 to 2013. And as you can see, in 2008, they started including the probable cases in addition to confirmed cases. So Lyme disease is on the rise. One of the main reasons for this is the increased popularity in people spending time outdoors, hiking and camping, and being where ticks live, and increasing their chances of being bitten by one.
Next, you'll have the pleasure of listening to me read a poem titled Lyme Disease by Nicole Parslow. My world is going crazy. My mind is going blank. I can't concentrate at all, and I only have this disease to thank. My body hurts. I have a fever and the chills. There's so many things I want to do, but I just don't have the will. I have no energy. I am tired all the time. There's so many crazy thoughts in my head, so many that I can't tell which are mine. It's hard to breathe. My heart races so fast. My body shakes. I just want this to pass. The headaches are unbearable, and the nausea is out of control. I no longer feel like myself. I no longer feel whole. They say I will get better. They say the Lyme disease will go away. I can't help but wonder how much longer it will be, or when I'll have a normal day. We hope you enjoyed our presentation on Lyme disease today, and that you always strive to avoid getting bitten by those parasitic little ticks.